cancer loves sugar and about the keto diet. So if you look here, that the glucose is used as an energy source by the process of glycolysis, the degradation of glucose through pyruvate. If there is oxygen, we all breathe, or our cells get oxygen, and we get 36 up to 36 molecules of energy plus CO2. If there is no oxygen, for example, when we are training a lot, the muscles don't get enough oxygen, the needs are much higher than the supply, then we get this anaerobic glycolysis. That means no oxygen. And we get only 2 molecules of ATP and lactate. Lactic acid causes the pain after training, especially if you are not trained. There is an enzyme, pyruvate kinase, that will help the process of pyruvate degradation. And there are 2 types of this enzyme. M1 is in all the cells, M2 is in cancer cells, and in growing divided cells. Why? Because this is, you see, it's not effective. It doesn't give us a lot of energy, but it gives us bricks for building the new cells. That's why dividing cells and cancer cells, the cancer's goal is to grow a lot, is to divide. That's why it uses this pathway, because you can't build new cells just from energy. You need some bricks to build new cells. And by the way, there were interesting research when the researchers, they blocked M2 type, and our normal cells stopped to divide. They don't get any of this pathway anymore. But cancer cells, they continued to divide and grow. That means that cancer cells, they are very highly adaptive, and they can use other pathways around to reach their goal. That's why there is a lot of research now trying to understand what is the difference between cancer metabolism and normal metabolism, normal cells, so we can affect these metabolic pathways so cancer cannot get any energy and building blocks for the new cells. This is the other field of investigations nowadays. In 1925, Otto Warburg observed that cancerous cells, they take glucose much more than normal cells. And they rely on this other pathway where no oxygen is used. That's why there was the idea that if we don't give glucose, then cancer cells will die, will starve. In reality, it's not so easy. Warburg phenomenon is just one piece of the puzzle, because there is also the reverse Warburg effect when the tumor easily uses oxygen. And also some tumors, they really love fats. We'll talk about it later. Other carb is fructose. It's a very abundant component of Western diet, what most of us eat. And fructose is associated with many diseases, not only cancer. Even moderate doses of chronic fructose, if you consume them often and chronically, may lead to increased risks. For example, there were studies in rats that were getting their moderate amounts of fructose. If you count it for person, it's like 1 cup of sweet drinks of soda a day. And they found out that there is increased risk of colon cancer in these animals. And now it's clear that cancer cells can really use fructose as a source of their energy. If we talk about sugar, it's for nowadays it's clearly associated with risks of esophageal cancer. All sugary drinks, cakes, fruits, many vegetables, they have these fast carbs that will lead to spike of insulin. And insulin, and also insulin-like growth factor 1, is the important factor that will increase the growth and development of cells, meaning it will stimulate the cancer to grow and develop. That means if we eat carbs, theoretically, this will increase insulin, this factor, and it will promote the growth of cancers. Also, we know that obesity is associated with increased risk of many cancers, including prostate, pancreatic cancer, breast cancer, ovarian cancer, colon cancer, some blood malignancies. And in general, these patients may have some worse outcomes compared to normal weight individuals. By all this information I mentioned, we can think that, okay, if we give these patients less carbs, if maybe they do some starvation, if they do ketogenic diet, it may improve their weight, it will decrease their insulin-like growth factor, it won't stimulate tumors so much, so it will give us a really good benefit for health in many ways. Some people starve, some people do keto diet, for example. Keto diet is like strict limitation of carbohydrates, meaning that the body won't get enough carbs from the food and it will have to tune its metabolism to fatty metabolism. It will produce ketone bodies from fat storages and feed the organs with them. And according to the previous research, cancer cells love sugar, they can't eat normally fats, that's why sugar is low, there is no insulin, then low insulin. That's why the cancer will starve, and this is a really good logical chain. Also, we know that ketogenic diet and calorie restriction diet, they increase the infiltration of tumors with the immune cells in mice. That means it will attract the immunity to kill the tumors. It's good. And there are some clinical trials on patients with cancer testing ketogenic diet. Unfortunately, they are very small and they did not compare patients with like ketogenic diet patients with just usual diet patients, for example, or other diet patients. They're not randomized. They're very small. And what we get from these studies is just that keto diet was tolerated very well, and there was some improvement of quality of life, and there was improvement of adverse reactions. So their treatment, chemotherapy, for example, was tolerated better. Of course, these are not the well-arranged trials, and we need bigger trials so we can understand better and maybe understand which patients would benefit from ketogenic diet and which will not. For example, maybe we should give ketogenic diet only for diabetic patients or those patients who were eating a lot of carbs all their lives, and we'll think, okay, maybe because of these carbs there was increased risk of tumor development, or maybe some tumors will have a benefit of ketogenic diet, some special tumors. And there is a recent systematic review about these investigations. By the way, there were some patients with neurological tumors, of brain tumors, some with ovarian tumors. I will leave the links below if you want to read more about it. But the information whether the ketogenic diet is very beneficial is still lacking. I really hope that there will be more good clinical trials in future. Anyway, in my opinion, if the patient has diabetes and, what I already told, was eating a lot of carbs all his life, maybe it's worth not trying ketogenic diet in these patients, but it's not official recommendations. It's just theoretical. Next, very interesting. Ketogenic diet is not for everyone. By the way, some tumors, they really love ketone bodies, they really love fats. And if you give them fats, they grow much faster. There is some information that these tumors may be located close to the fat tissue in the body. For example, if the patient has breast cancer, there is a lot of fat in breasts, and maybe it's a sarcoma from fat tissue, liposarcoma, or also diffuse large B-cell lymphoma. They may be fat-loving tumors, but again, not all of them. So it would be really ideal if we could, after taking the biopsy of the tumors from the patient, see the metabolism, study the metabolism of the tumor, to understand what this tumor, what it prefers, so what's better to choose for this patient. But for now, it's not applicable, unfortunately, in the real life.